Medicare can seem confusing and scary, but it doesn't have to be. It's true, Medicare has complicated rules, a new language, and possible penalties. There are a dizzying number of options. The great news is that you can benefit from Medicare rules if you have unbiased expert guidance. Get your free guidance from J.O., a nationally recognized Medicare expert and author of the best-selling Maximize Your Medicare. Call the number on the screen today.
Okay, let's just get started right away here on Part B. Part B of a Medicare card, the federal red, white, and blue card, I probably wouldn't have called it medical. I would have called it services. The bottom line here is that services are anything that is not inpatient hospitalization, is not skilled nursing facility care. And don't get me wrong, home health care after inpatient is a Part A. Home health care that is not like that is under Part B. Okay? And then in addition to that, hospice is not part of Part B. That is part of Part A. Everything else under Part B. This also includes medications that you get, for example, infusion services, medications administered in an outpatient healthcare service location is under Part B, not Part D. Not Part D. Complicated stuff. Crazy people have written books about it for 8 years. Okay. Let's take a look at the card here. John Smith, a generic card. John Smith, born or coverage date reads March 1, 2016. So what do we know about John Smith? In most cases, John Smith was born in the month of March of 1951. During the month of 1951, March of 1951. The important thing to note is it doesn't matter if he was born on March 2nd. It doesn't matter if he was born on March 31st. The coverage date begins on the 1st. That's a point that some people miss. What else can we say about John Smith? John Smith may have been born on April 1st, 1951. If you're born on the 1st of the month, you are actually eligible. Your coverage date begins the month prior. Quickest example, New Year's Day, baby. Your coverage date is December 1, not January 1. Now you'll never forget. Okay. There are a couple of other situations when John Smith could have been eligible for Medicare prior to the age of 65. What are they? The largest group of you are those who have received 24 months of Social Security Disability Insurance Benefits, SSDI. Go to the video on the YouTube channel. I've got a special standalone video called Disability and Medicare. The second group of you is that you could have had ALS, Lou Gehrig's disease. The third is you could have ESRD, end-stage renal disease requiring dialysis. Okay. Under ESRD, there is a waiting period until you will become effective for Medicare Part A and Part B. By far, the number one question I get from clients everywhere in the country is, can I delay? Can I delay? And the answer is yes or no, depending on your situation. Let's go through the yeses first. If you are the full-time employee and you're covered by health insurance at a large employer, which is defined as 20 full-time employees, the answer is yes. If you're the spouse of a full-time employee covered by health insurance at a large employer, the answer is yes. If you work at a small employer, now it gets a little trickier, because certainly the carriers, let's say you work at a small employer and you're covered by your small employer insurance. The carriers are telling you yes. Okay. But what I'm going to ask you at that point, and it's subtle, it's very subtle, is you can ask yourself why. Why? Because the reality is, in most cases, in the overwhelming number of cases, if you work at a small employer, it's not a great idea to be on the small employer health insurance and Medicare Part B. It's in most instances, I didn't say every, in most instances, it doesn't make sense. I promise you, within 5 miles of where you're listening or watching, someone is making this error, losing thousands of dollars a year per employee. I'm sure of it. I'm sure of it. The reason is I uncover this every single year, just like clockwork. Just like clockwork. Someone stays on their small employer health insurance plan without thinking through it, without flipping over the rocks. Thousands of dollars of inefficiency get lost. No, well, they don't get lost. They get paid to the small employer health insurance carrier. That's why I called it the nasty secret. Fourth, you can actually delay if you're on COBRA, but for 8 months only. Medicare Part B doesn't have a late enrollment penalty until you don't have health insurance for 8 months. Okay, so while Medicare and you tell you that COBRA doesn't work, there's the notable exception there, which is that it doesn't work after 8 months. It does work during that 8 months without penalty. The vast majority of people cannot delay. Who are you? In particular, if you are the Medicare eligible spouse of a retired employee, you cannot delay. Secondly, if you are on COBRA for a period longer than 8 months, you are going to be subject to the Part B late enrollment penalty. And the basic reason is that COBRA doesn't count as health insurance for Medicare purposes for Part B. Now, crazily enough, the standalone the prescription benefits inside of a COBRA plan in the overwhelming majority does count as credible coverage. Do not ask me why that is the case. Okay, but for Part B purposes, you can have an 8-month gap of no health insurance. You can. And COBRA, even though it doesn't qualify as health insurance, you can have it in there and still be for yourself be covered. Meaning at the end of that 8 months, you could have enrolled in Part B without penalty. After the 8 months is over, however, then all bets are off. You would then be subject to the Part B late enrollment penalty, one that never expires, 10% per 12-month period that you did not have Part B coverage. Does that sound very complicated? Yes, it is. It is very complicated. Because especially what ends up happening is people are working beyond the age of 65. We're not going away from that. That is not the world today, which we had even 5 years ago. Full retirement age of Social Security has increased. Financial reality has changed. People's attitudes towards working for longer have changed. We're going to have more people working beyond the age of 65. What that has introduced are these complications, and this question, number one question of Part B, can I delay? In addition to missing the rules and then getting penalties, is whenever I see these cases, whenever people have approached me, here's the situation, which is that something gets missed and it's very, very costly. Very costly. Let's take a look back at the yes. At the yes here, you can see this. There can be situations where you accept COBRA for some months and then switch to Part B later. Take a look at that list. You're trying to cover family members and the family coverage would be too expensive. Hello, Florida. IRMA, you're trying to keep away from IRMA because IRMA may introduce a health insurance premium for Part B, which is $500 plus a month. You've already reached the out-of-pocket maximum under COBRA. You have a very serious, someone in your household has a very serious health issue. Maybe COBRA doesn't cost you anything because your employer pays. It goes on and on. So the idea that people just say, okay, COBRA doesn't count, and then they throw it away. The number of exceptions here is so large, and it's getting larger. And the result of it is that by not examining it, it's very expensive. By not examining it. Let's stop there here on the question of can I delay? Under Part B, it's a different setup than Part A, meaning that this is one that people will be very familiar with. There's a monthly premium. There's the table adjusted in premiums there on your screen now. For most persons, this is $144.60 for the remainder of 2020. We do not yet know what the premiums will be for 2021. It gets reset annually. Irresponsible projections to say, well, the premium's going to go up by 40% due to, all the debt we've taken on. Let's calm down. That's hysteria. There are laws to put limits on the amount that it can be raised. Anyway, the monthly premium, unchanged means basically that is a structure that you're used to. You owe a monthly premium. If you do not accept Social Security, you can pay directly on a quarterly or monthly basis. That is possible. You can have it directly deducted from your Social Security benefits. No question. Many people know this. Part B, you can pay with Social Security benefits. If you don't receive Social Security benefits, you can pay by credit, by transfer, or by check. Importantly, by the way, if you itemize, you can take your money from your HSA account if you have a balance. Okay. You have an annual deductible of $188 a year. So unlike Part A, which is by benefit period, this is an annual. And it's reset annually by the CMS, which is the Center for Medicare and Medicaid Services that governs Medicare. It's important to note here a couple of things, not here on the slide intentionally, which is the CMS is keeping track of whether or not you have satisfied the Part B deductible in a year. Okay, so if you're on original Medicare, Part A, Part B, and Medigap, for example, or Part A and Part B alone, then the CMS is keeping track of whether or not you've met the deductible. If you're on Medicare Advantage, the Medicare Advantage carrier is the one who is administering everything. There's a difference. Now, the subtle points here are the following, is that you need to understand that the CMS has outsourced the accounting. And that is code for there can be errors. The errors are not necessarily the case. They're not necessarily the cause of governmental red tape. There are other sources that can create this. And one of them is that the healthcare providers may have delayed or not efficiently processed your claim. Now, this is super important because the stuff you could possibly buy on top, Medicare Advantage, Medicare Supplement, or Medigap, for example, right? They entirely depend on whether or not you've satisfied the deductible. So Medicare Advantage, those groups, if your doctor or the lab has not sent in the claims, the carrier doesn't know. So as a result, can you get a bill multiple times when you thought you've satisfied whatever deductible, whether that's the Part B deductible of $198 or the health deductible under your Medicare Advantage plan? That can occur. There can be this error, but that's the source. Okay, and you can see this. You can easily see it. Someone with serious health matters. They go to the doctor number 1 on January 1st. They go to doctor number 2 on January 6th. The chance that by January 6th that the CMS has understood that you have met the $198 deductible by the time you go to the doctor's office on January 6th, pretty low, right? So as a result, the doctor on January 6th doesn't know this. They call the CMS, you've not satisfied the deductible, they send you a bill. This can last for months, if not longer, in the worst case. I hope this doesn't happen to you. But I just want to point out to you that it is not the carrier, Medigap carrier in this instance, right? The Medigap carrier can only react if the CMS accounting tells them that you've satisfied 198, not before then, right? Because basically Medigap, for newcomers, Medigap will cover the rest, all of it, okay? Especially in Plan G and Plan N, besides the excess charge. So there are some subtle differences, but they will cover the 20%. That is no problem, but only after you've satisfied 198. And the only way that the carriers can know is they ask the CMS. Now, I swerved a few minutes out of there because I can't stress this enough, because you can understand. Sometimes my life is fairly unpleasant, right? I mean, it's like, Jay, I thought you said that the Medigap carrier was going to pay. And then they say, okay, well, you've suggested this carrier or a plan that doesn't work. That is not the case. This is not the contract not working. This is the fact that they're relying on a piece of data, and that data is flawed, has an error in it from the CMS, and I can't resolve the source. I can't tell you it's always this reason or it's always that reason. I can tell you, though, that there can be multiple sources of error here. You can see other videos that I've put out. For example, in that instance, Plan F does solve this. Does. You can check out the video on that topic alone. Once you've satisfied 198, right? Once you've satisfied 198, then it's a structure many people know. Medicare pays 80, you pay 20%. That's it. Okay. Now, we need to be careful on 2 extra points. Number 1, Medicare pays 80% of an approved amount. And by approved amount, what I mean here is there's like a list, an MSRP, a list of services and prices. Medicare will pay for 80% of that. However, can the doctor or the lab charge more than the approved amount? The answer is yes, they can. They can. I've got another video about the excess charge, comparing Plan G to Plan N. Go and check it out. It's too long. It's too complicated for today because I'm here to talk about Part B. But the point is that Medicare will pay for 80% of the approved amount. Please know that Part B providers can charge more than that, and you are responsible for all of it. Simple example, let's say the MSRP is $10,000 and the doctor charges $11,500. Is this legal? Yes. Medicare will pay 80% of 10,000, not of 11,500. That leaves you responsible for 20% of 10,000, 2,000, plus the entire overage of 11.5 thousand minus 10, which is 1.5 thousand. So your bill under original Medicare would be 3,500. That's the way to think through this. So sometimes people get confused. They think that, okay, Medicare pays for 80% of the 11,500. That is not the case. It's of the 10,000 based off the MSRP or the approved amount. Now, the kicker here, which I've not even put on this slide, right, is here that you need to be careful because in addition to the fine print here of Part B is the fact that Part B, like Part A, there's no annual out-of-pocket maximum. And here is the financial risk of the red, white, and blue card. This is the financial risk of this card. It is a very good chassis to a card. There's no such thing as health insurance for $144.60. Not at 65 years old. There would be wildly incompetent health insurance. However, the fact is there's no annual out-of-pocket maximum. In other words, your potential financial downside is theoretically unlimited. I'm not hoping that for you, of course. My point is, if you continue to if you have a bad health year and you sit only with Part B and Part A, then you can have 20% times $1 trillion, right? It's still $20 billion. That's my point. You'd be on the hook under Part B if you were on Part B alone for the entire amount without limit. That's something which is fundamentally different from Medicare and the way that health insurance worked either in the private market, small group market, or if you were employed at a large employer. That's it for today. Hopefully you've gotten some things from this video, which don't sit here in my book or with my same amount of emphasis. And I do try to make these points. I'm not going to kid you that just thinking through the enrollment part of Part B, and I get this comment after I continue from my clients, which is my clients, I go back and forth with my clients. Have we thought through these issues? Issue 1, issue 2. We get through 5, 6 issues, and people are shaking their head. I never knew that there are this many variables to consider when deciding on when the best time is to enroll. Because most of the time, people are focused on their one person. We've got families, you've got employment, you've got unemployment, you've got other moving parts. And only when you think of the moving parts together can you come up with the efficient solution. Hope you enjoyed today's video. Thanks for watching. Be sure to subscribe, please. Leave your comments, ask your questions. I'll try to respond as soon as I can. Thanks. In today's video, we've got Medigap versus Medicare Advantage, the number one question on people's mind as they decide on what's best for them under Medicare. Welcome to the Maximize Your Medicare channel. My name is J.O. I'm the author of Maximize Your Medicare, published here in 2020. You can get it on Amazon, pretty much anywhere you can get a book. So I've got a lot of different videos and different things. The number one question that most people ask is, which one is better? How do I choose between Medigap and Medicare Advantage? And that's very important stuff, because the reality is that 5 years ago, for example, when I had a previous edition of the book, the conclusions were much different than they are today. The fact is, Medicare Advantage has improved enormously over that time period for a variety of different reasons. And I'm not going to delve into every last reason. There are a number of different factors. Simply put, though, there are a lot of capable competitors, all understanding there are 60 million Medicare beneficiaries. It makes logical sense, just common sense. And that's what we're going to do today. We're going to use our common sense to be able to compare and understand what's going on here between Medigap and Medicare Advantage. And that's here on this outline here, as you can see on your screen. We're going to talk about Medigap. We're going to talk about those features of Medigap that make Medigap a very good choice for many people, of which there's tremendous satisfaction. We're going to talk about Medicare Advantage. We're going to talk about those features which distinguish it from Medigap. And finally, at the end, I'm going to put them side by side for you. And I'm going to give you my perspective on what people should take away when they're considering Medigap versus Medicare Advantage. Medigap is very popular, and for good reason. And here is why. For people who are not, familiar with Medigap, there are plans lettered A through N. Okay, A through N. In beginning of January of this year, plans C and F are no longer available. Now, they're no longer available to those people whose Medicare Part A and Part B do not read prior to January of 2020. Meaning, if you have Medicare Part A and Part B on December 2019, C and F are still available. For everyone else, it's not available. Okay? Excuse me. Regarding coverage, it's quite clear. The deductibles, Part A, inpatient hospitalization deductible, Part B, right, for plans C and F are covered, but for the rest of us, you've got to pay for the Part B deductible from now on. There are two plans that cover the Medicare Part B excess charge, and those two plans are Plans F and Plan G. You can see other videos when I compare Plan G and Plan N to each other on what excess charge actually is and what its function is. The most important takeaway here, though, are the two lines at the bottom, which is that all Medigap plans are standardized, meaning Medigap Plan N from Carrier 1 is identical to Medigap Plan N at Carrier number 4. They're identical to the letter. They must be. They're not kinda, sort of the same. They're precisely the same. That means that you can compare them. You can compare the prices and know that you're in fact comparing apples to apples, exact apples. The second one is a little bit more complicated, which is it's grandfathered, and this has a number of implications. By grandfathered, what I mean is once you're in, nothing changes. So it's not only Plan N is known and comparable from Carrier 1 to Carrier 4, But the fact of the matter is that through time, nothing changes to your contract. Nothing is allowed to change to the contract. And this is a very important distinction, right? Which is that some people say, well, it's the same next year as it is this year because the carrier didn't choose. No, that's different. This, under Medigap, the carriers have no leeway to change the contract, period. Meaning, once you're a policy owner, as long as you stay and pay your premiums, you remain a policy owner. The only one that can cancel is you. I don't need to tell you, I'm going to swerve here to, current events. We have a volatile public health situation. I think that is the nicest way to put it, right? And the fact of the matter is the fact that that Medigap is this stable, right? The premiums can increase, but the language is this stable, makes it a very stable financial contract. Health insurance is a financial contract. Medicare, Medigap, Medicare Advantage are health insurance, thus their financial contracts. Medigap is the most stable financial contract I could mention, period. This is the coverage grid for those people who want to know, and we're not going to spend any time on this. The reality is you can find this grid everywhere. You can find it on the website to the book, maximizeyourmedicare.com. It's up there. You can find it on advertisements that you receive in the mail. It's in there. You can receive it in packets, application packets you get in the mail. All in there. Okay? Guess what? They're all the same thing no matter where you get these grids. Nothing changes here, period. And that's why I call it standardized, right? It's not just Medigap plans. It's a standardized set of Medigap plans. Very important component. Application into Medigap can be tricky. There are actually 3 ways of getting accepted. This is how I want people to understand it. First, there's Medigap open enrollment. This is a formal term. Okay, the CMS, the federal government, the Center for Medicare and Medicaid Services has defined this term. Medigap open enrollment, the way you should remember it is when you turn on Part B, you're in Medigap open enrollment, period. That's it. It lasts for 6 months. During that 6 months, you can apply for any plan available in your residential location at the best possible price. There are no exceptions to this. Again, part of the reason of Medigap is its stability, and part of that is that the sellers, they do not have any discretion during Medigap open enrollment. The second way is guaranteed issue. Now, guaranteed issue is trickier. Okay, in other words, there are certain extra circumstances when you can apply for and be accepted to Medigap without underwriting questions, without medical questions about your history, your prescriptions. Okay. And there's a list here. We're not going to go into every single item, but let's just see, you can see there on your screen. In certain examples, a Medicare Advantage plan cancels. It is no longer available in your location. In that situation, this special enrollment period does exist. You can change to Medigap. Now, it's important. You've got to see that, that during those periods, you must specifically qualify. People don't take advantage of this as much as they could or should, if you will, depending on your situation. Should, of course, is a subjective term. People don't examine it. For example, let's say you move from location 1 to location 3. You have a special enrollment period. You can get into Medigap. but you have to examine. Okay. But that is the second. And these are set by the federal government. They are set by the federal government. Unfortunately, what I have to tell you negative about guaranteed issue is I wish they would have called it Medigap guarantee issue and Medicare Advantage guaranteed issue, because they are slightly different. You can send me an email if you have private questions there. There's a third way of getting into Medigap. So now let's just say you don't qualify for Medigap open enrollment. You don't qualify for get a guaranteed issue. Are there certain other ways? And I call it guaranteed acceptance. And let's just call guaranteed acceptance for the moment, extra. So what happens is the federal government has Medigap open enrollment as well as guaranteed issue. These are set by the CMS. On top of that, guaranteed acceptance can either be granted by the state or the carrier. Okay? And what happens here is the state may be granting consumers extra rights. Let's just take, for example, the state of New York. In the state of New York, there is year-round Medigap open enrollment with no medical questions. This exists. Doesn't exist in other states in the country. In California, there's something called the birthday rule. In Missouri, there's something called the anniversary rule. In other words, there are different state-specific clauses which expand your rights to enroll in Medigap without medical underwriting questions. And this is important because there can be situations where you wouldn't qualify otherwise under those other two criteria. And you have a pre-existing condition, which was normally the basis for a rejection of an application. Now, in certain locations, this does exist. We're not going to be able to go through this every single example. That's impossible. It's just that people can get our expert advice in order to examine to see whether or not this applies for you. And these are not negative. Let me just be very, very clear. These are not negative. These are extra ways that you can actually get and be accepted into Medigap if that's the path that you want to pursue. And let's just say, for example, well, I didn't know these rules, Jay. I didn't know about Medigap open enrollment. And now my window has passed and I've got to move, or my plan was canceled, my retiree plan got canceled, et cetera, et cetera. There can be other reasons, other ways to get accepted into Medigap. I'd love to tell you there's a shortcut, but what I can, and I can't do that, but what I can tell you is that these rules are in the buyer's favor. There's a common theme in Maximize Your Medicare, and that's really what it is, which is that these extra options, these extra entryways are in the buyer's favor. They're not excuses for you to get rejected. They're ways for you to get accepted. A very critical difference. Let's move on to Medicare Advantage. Some people now call it Medicare Part C. I just prefer Medicare Advantage because there are too many independent letters, flying around. Medicare Advantage is an annual contract. Okay, and that's going to be a very important component. Every plan is approved by the CMS, which is the Center for Medicare and Medicaid Services. They're approved every single year. You cannot have a Medicare Advantage plan for 2019. The 2020 version is going to be different. Everything here, the things to know about Medicare Advantage are that everything here, all of the administration, all of the decision making is handed over to the Medicare Advantage carrier, an insurance company. Okay? And in general, that Medicare Advantage plan must provide benefits which are at least equal to the red, white, and blue card by itself. In addition to that, there are some other requirements, and it's not even here on the slide. Your key point is every Medicare Advantage plan must have an out-of-pocket maximum limit. Must. Right? I said that they are all approved on an annual basis. Well, there's a long list of parameters, that requirements that every plan must have, and that's one of them. And it's a key one because it puts a limit on your healthcare expenses in a given year. Now, Medicare Advantage combines the services from Part A, Part B, and in most cases includes prescription drug benefits, meaning the Part D. There are certain instances where Medicare Advantage plans don't have prescription drug benefits, and there is a reason for that. For example, VA. You can know that people who have Veterans Administration benefits, they can get separate drug benefits. Now, very important here, also not on the slide because, these are just rote. You need to be enrolled in Medicare Part A and Part B. There's no getting around that. You must be enrolled in Medicare Part A and Part B in order to enroll in any Medicare Advantage plan. Generally, I would say that Medicare Advantage is this choice that you see is the third point on this slide. It's a cost versus the fact that it's a moving target. And moving target sounds negative, but not necessarily. Meaning that you can find a plan, a Medicare Advantage plan that costs $0 a month, right? That the Medicare Advantage plan costs you $0. That exists in most locations in the country. Now, the type of plan can vary wildly, meaning there can be 10, 15, I've seen this, 15 Medicare Advantage plans that cost $0 a month. What you need to know, and that's why by moving target, is every line item, copay, deductible, health deductible, doctor's visit, services, inpatient hospitalization, all of those little details, all of them change on every plan every year. There's no getting around this. Okay? So that's what I mean. On one hand, you have $0 copay or lower than Medigap. On the other hand, you have moving parts. Okay? And this is the key thing. Because as I said about Medigap, there's no question that its stability is the source of comfort for many. That said, this is a financial matter. I didn't say that it's superior at every price, irrespective of price. I don't say that. I wouldn't say that about any financial matter. No financial matter. It can't be independent of price. There's no such thing. Annuity, life insurance, stock portfolio. I didn't say that, this option is better irrespective of price. You'll never hear me say that about any financial topic. Okay? Medicare Advantage, there it is. Much lower premium. And to some people, that doesn't matter. I get it. To some people, that difference in premium is groceries. So there's a practical reality here. Practical reality. I am all about my corner is practical reality. That's my corner for sure. Literally before going into when you can change, those are the key things here. And let's just go back here actually. And you can see that in the combines, because I kind of glossed over this idea about the moving parts. The third point here under combines Part A, Part B, and Part D mostly, the third one is network. It's very important to understand the network. If I have to tell persons about Medicare Advantage, it's then those two. Annual contract, meaning all the moving parts move every year. Number two, network. These different plans have different networks. Let's just take an example, HMO. You've got to stay inside the network or you're responsible for the entirety of the cost. And not only that, that your cost out in the out of network and that you have to pay 100%, it doesn't count towards your out-of-pocket maximum. Okay? PPO, different. PPO, you can go to in-network, which will create lower costs for a doctor's visit. A key part is that you can go to doctors who are out of network. They simply have to be able to receive your federal Medicare card. If they accept federal Medicare card, they're defined as out of network for PPOs under Medicare Advantage. This is a very important distinction between Medicare and pre-Medicare health insurance. The PPOs under Medicare Advantage are far superior by nature. Why? Because that includes every doctor and hospital healthcare provider that accepts the federal Medicare card. Okay. Nevertheless, it's still important to understand how the networks work. For example, you can have situations. Dr. X, Dr. Magic, whoever your favorite doctor is, he could be in network in 1 year and out of network in the next year. He may have elected or he may have changed status within the calendar year. So when I point out moving parts all the time, this does exist. Very, very important fact. And these kind of are all related to each other, right? Meaning that moving parts, network, and all of the different individual cost sharing responsibilities, price points, right? I call these nickels and dimes. So you're stacking up nickels and dimes of costs, stacking up little parts where you may not be comfortable. But to some people, maybe the stack of nickels and dimes isn't as big as the Medigap premium, isn't as important to you as the difference in price. That's the consumer's decision. It's not my decision as broker. It really is not. I have clients in Miami-Dade, Tucson, Washington State. It's not my job to assign you the value of your money. It's my job to explain these differences and allow you to choose. Critical point. Crazy people have written books about this specific thing. It's a very important component here when you're comparing Medigap and Medicare Advantage. This question of, can I switch from Medigap to Medicare Advantage or from Medicare Advantage to Medigap? First of all, the answer can be yes. And it's not here on the slide because I don't want to put it on the slide for private reasons. The ability to switch from Medigap to Medicare Advantage is unlimited. And this slide tells you those dates and especially the annual election period. Let's just say, for example, your premium on Medigap is now $400 a month and it gets too expensive. You're 80 years old. Your mother is 80 years old. Your mother's 85 years old. You can switch from Medigap to Medicare Advantage without restriction. No problem. You cannot say the same thing from Medicare Advantage to Medigap. That is restricted. So you can remember, I pointed out all those different times that 3 ways to get accepted to Medigap. If one of those 3 do not apply to you, you've got to answer medical questions. Okay? You must satisfy medical questions. If you want to change from Medicare Advantage plan number 1 to Medicare Advantage plan number 5, you can do so in an unrestricted way during the annual election period and during the open enrollment period. 2 windows every year. And then there can be exceptions to the rule, right? Today is not going to be about every last exception because, and I'm going to tell you, it's fairly risky for me to even go through that because the way this is going to work, somebody's going to say, you didn't mention this one exception and, I'm to blame. My clients, I won't leave that to chance. Okay. Here on public video on YouTube, you can understand. There's nothing good that me going into all of the individual or even attempting to go through all the individual exceptions. I want to talk about Medicare Advantage. Now, I've told you about this switch option, meaning that yes, from here to here, from Medigap to Medicare Advantage, no problem. From Medicare Advantage to Medigap can be restricted. Let's just say they were the same price, exactly the same price. Which one's more valuable? Just on this fact alone, the flexibility option from here to here, that's worth money. That's a financial option. In other words, if these were your 2 choices and they were exactly the same in every other way, over here should be more expensive. Medigap should be, right? We don't need to know a thing about insurance in order to come to that conclusion. That's just your common sense. We could change it to plumber's annual service contract. You would have the same conclusion. I get to switch from plumber 1 to plumber 2, and I don't get to switch from plumber 2 to plumber 1. This one over here is going to be more expensive. Of course it is. Now, some people have said wrongly, over here, one of the risks you run is that Medicare Advantage could be going the way of the dinosaur. I have never believed this. My book is in its 8th edition. I never believed this. It used to be a very inferior contract as a financial matter. That's no longer the case. But more to the point is that you can tell that Medicare Advantage is not going anywhere. It's 30% of the market today. Don't be surprised if half of the Medicare Advantage beneficiaries are on Medicare Advantage. Half. That all said, and you understand, and there's a very important part of this video, which is the competition amongst the sellers is fierce, and fierce is an understatement, right? If you'd watch the video, Life's a Gamble, they all know they have every Medicare Advantage carrier knows that they have competition right next door. And guess what? They're not underestimating each other. They know that the next carrier is just as smart with just as many computers and just the same lawyers. They know this. So they're having to compete on every single line item, every single one. And they are. And this is benefiting the buyer, meaning the consumer, meaning you. There's no other way about it. And again, I'm not even saying anything about insurance. If I just told you this about Corn Farmer, you would have the same conclusion. Ultimately, when you're comparing Medicare Advantage and Medigap, it is difficult. And the reason it's difficult is let's just go back to my 2 silly hands. Medigap over here, Medicare Advantage here. It used to be a situation where Medigap, the quality of contract, the fact that it's standardized and grandfathered, was so superior to Medicare Advantage that anyone that could afford the premium, it was clear. It was very clear. That day is gone. I'm not saying that day is gone forever. I'm saying that day, today, that situation does not exist. And why? Over here has become more competitive at a alarmingly fast rate, breakneck pace. I'd expect that to continue into 2021, by the way. And you can see this grid on, it kind of summarizes today's video. There's no getting around it. The first one, Medigap is a clearly superior contract. The language, the nature of the contract itself is superior. There's no other way of putting it. Like I said, two plumbers, one, the contract never changes. Over here, this one can change every year. Which one's better if the price was the same? We are not talking about insurance. Any contract. This one just happens to have the name of Medigap. This one just happens to have the name of Medicare Advantage. Period. Simple. Second one, ability to switch. Again, from Medigap to Medicare Advantage, this way, no limit. From Medicare Advantage to Medigap, this way, limited, possibly limited, okay? You know the way that Murphy's Law works, right? Which is at the time that you most want, at the time that you most need, it's not there. What does that mean? Oh, I went to my urologist, I went to my OB or my GYN, I guess I should say, and I got the worst news. Now I want to go over here. Guess what? That's the time you can't. Why? Because the sellers of Medigap will be able to ask you medical questions unless you fit under some other exception. Third, network. Medigap has no network. Medigap has no network. Any healthcare providers that accepts the federal Medicare card, they accept Medigap, period. Period. Medicare Advantage. You're saving on cost by using in-network. Under HMOs, now you've got to go get a little bit more specific. You've got to squint at these plans. HMO, if you go to out-of-network provider, you're responsible for the payment. Let's forget about referrals for the moment. In other words, every single line item is different. But let's just get back to the network. PPO, no question better. You get lower cost by in-network. You have lower out-of-pocket maximum in most cases in using only in-network. That doesn't mean you won't be covered if out-of-network. You can still be covered out-of-network. It's just that you will get a higher price for your medical services. Let's continue on. Premium, no question about it. Medigap is more expensive. That's it. And to give you an idea, turning 65 in many states in the country, right for a female, right at the low hundreds. I've seen as lower than $90. That can exist. Over here, Medicare Advantage, plans can be zero. One of the reasons, a big reason, that I'm concluding that Medicare Advantage has closed this difference, these two have become a lot closer, is this one now is clearly cost superior from a premium point of view. 5 years ago, you used to have a situation where Medicare Advantage was both inferior from a contract and more expensive. That used to exist. That didn't make any sense to Jay. Unless, some very extenuating circumstance. But the base case would have been, why would I pay more for a contract that's inferior than this one where the contract is superior? That situation didn't exist. Now, however, all of those little line items have improved. One of them is premium. Prescriptions. This is a secret. Oh, secret, it's not, secret. When you have Medigap, you have to have a Part D plan, right? Otherwise, you get a late enrollment penalty for prescription coverage. Okay. What you're not really told, is that Part D, let's just call it 3 medications. Do not be surprised at all. Do not be surprised at all if your Medicare Advantage plan has superior prescription drug coverage than your Part D plan under Medigap and a Part D plan. Do not be surprised. We're not going to get into all the mechanics. Basically, the bottom line here is the carriers have devoted more time and money and effort to helping drive down prescription drug costs. And therefore, you can have this extreme example. In another video, I've told persons and updated that insulin $35 capped in 2021. Today and for years, you've had certain brands of insulin at $0 copay. This has existed. There's no Medicare Part D with insulin at zero. Nada. Competition. It's about a tie here. It's about a tie. Both markets brutally competitive. Look, 60 million Medigap, Medicare Advantage possible policy owners. Of course they're going to compete. Of course they're going to compete. And like I said, fierce. Medigap, here's your example. Depending on your county, I can find 5 to 7 sellers within $10 a month. That's how close. It's huge comfort to the buyer, right? I could be shopping now on Amazon or eBay. I can compare exact apples to exact apples by price alone. Now, it's very important for me to stop here. That is not me saying that all carriers are the same. No, absolutely not. In other words, I told her earlier, oops, it's Darth Vader again. Anyway, back here. My conclusion here is not that all Medigap carriers are the same, meaning that if there's a price tie here, I will definitely have an opinion. Definitely have an opinion on which carrier. Can I show that out in public? 100% no. You'll never hear me shout out a particular carrier over another on any of my videos. Not a single one. Doesn't matter what the topic is. Doesn't matter what the product is. You won't have that. I won't be examining, a particular annuity and telling you some good and bad about it on a YouTube video. Not happening. Never going to happen. Why? Because that will be highly dependent on so many moving factors that there's no way it wouldn't be a private conversation. Private. It'll change on your state. It'll change on your situation. It'll change on the carrier's different ability to handle bills, etc., etc. The list is so long and will change from person to person no matter where they are. Sorry. We're almost done here. And I put here brokers. And I tread carefully, right? So I'm a broker. Under Medigap, it's still my recommendation to contact a broker, independent. If you're shopping for a car and I get to buy a Toyota, a Mercedes, a VW, and a Buick, Cadillac, if I can go there and I can directly compare them and look at features, etc., wouldn't I want to see them all side by side? The answer is clear, right? Does this mean that you go to any broker? Well, maybe, but my point is that is still a superior approach compared to just going to the Buick dealer. Fine, that could be the top of the line Buick. Nevertheless, Toyota may have a set of features at the same price point, or may have better features at a lower price point. When you go to the Buick dealer, you don't know for sure. The Buick salesperson cannot tell you about the new BMW at the same price point. They don't have the authority to do so. That's your captive agent. A broker fulfilling fiduciary responsibility, right, under the presumption that the broker is doing that, has to tell you. They've got 5 different car manufacturers. These are how they compare.
Mike, or yeah.
That's the simple practical reality here. And now you can understand. Now, are there going to be situations? Look, I went to my car salesperson at Buick and that's my, my friend's son. Does that happen in the real world? Yeah, it does. I'm not disputing that. Does that mean that's your basis for choice? I'm going to leave it to the consumer. That's your business. I'm just telling you about the way to think about the way the captive agents versus brokers, how it actually works. Under Medicare Advantage, it's actually pretty complicated. And you can see easy examples. Just go on YouTube now. Not now, because you need to keep watching the video, right? The fact is that if you look up Medicare Advantage on YouTube, you won't find that many videos. Not when compared to Medigap videos. Why? Ask yourself why. Medicare Advantage is 30% of the market. That's 20 million enrollees today. Probably going up to 50%. Multiple CEOs of Medicare Advantage carriers have stated such. They're probably right. They are armed with lots and lots of information. Now, unfortunately, the issue is that people like me marketing this stuff is more complicated. It's more complicated. I mean, we're about to enter a period where all I'm doing is clicking, passing exams, checking out plans and carriers, and getting approvals for every single one in every single location. And there's no shortcut, period. There's no shortcut. The amount of extra work that I do in order to do this, right, is a lot. It'll take weeks of work hours for me to get through so that I can represent Medicare Advantage plans, so I can represent Part D plans. Because guess what? That menu in Hawaii is different than the one in Texas, which is different than the one in New York, which is different than the one in Florida. And there's nothing I can do about it. But for Medigap, it's simply, okay, well, Plan N is Plan N everywhere. That's why there's so many videos also, because then I can get approval in all the multiple states with the top carriers, no problem. Over here, I can't do that, and there's no shortcut. So unfortunately, here's your bottom line, and this is going to be my last point. Is unfortunately, the way that this stuff is presented to you has this inherent tilt. It's got this inherent tilt that favors Medigap to Medicare Advantage. More videos, more information on YouTube. Not so much information over here on Medicare Advantage, right? Not nearly as much. But the reality is, and I already pointed it out to you, I've given you the secret, which is that Medicare Advantage, this difference in coverage and quality has dropped. I've not even talked about individual plans yet. I'm just talking about the general nature of these Medicare Advantage plans has narrowed this difference in coverage. And I've already told you, this one is superior in cost. Now, to some of you, $100 a month is not a reason. Like I said, over here, now let's say it's at $300, $350 a month versus $0 over here. Okay, now $350 times 12. 350 times 12, that's $4,000. Okay. $4,000. Okay. So I like this better than this. Let's just say, do I like it $4,000 better? You're living on fixed income, for example, on Social Security.
It's just because I'm stupid.
You may want to think twice.
So basically,
That doesn't mean that I'm here saying this is always superior, right? Because you have to get and deal with the moving parts, the annual contract network, knowing that all the moving parts move. That ultimately is and that's why I find it hard to believe that you can get the answer on a 5-minute Medigap versus Medicare Advantage, video. I'm going to be spending what, 40 minutes? The better part of an hour. And I'm still not even close to done, right? Because I've still not talked about every single plan in your location. So complicated stuff. You can just see, keep your eye out on the ball. That not get confused on the most important aspects of Medigap versus Medicare Advantage. That's the contact information there up on your screen. On your screen now, email, websites. You can reach out to me. I'm actually, people have asked me, do you actually answer all these questions? I do. I am looking at these questions myself. Now, it may be happening at 3 o'clock in the morning, but I'm doing it. Okay. And I'll continue to do so. Your first call, your first inquiry is free, right? I do have the right to charge you. I would never do so without telling you in advance and without your advance agreement. Okay. Hopefully you got something from the video. Be sure to subscribe to this channel. I know there are lots of videos, and I know our society has this idea of, I'm going to get the quick answer. I want the bullet point answer and just have the quick and snazzy answer. I get it. Maybe you want snazzier videos with, prettier people. Fine. Okay. I'm not going to be able to solve that one. And I can't, I got this Midwest nasal Midwest voice. I'm not going to be able to fix that. Well, I could try to, but however, I'm trying to give you some information about these extra details, because these extra details, even a single one, can make you thousands of dollars of difference. Even the benefits are going to be that much better to you. Maybe it's going to save you that amount in premium. Either way, that's the same thing. And unfortunately, there's no shortcut to the idea that a single one of these details can make that difference. So I'm trying to give you a feel for all of these moving parts as best that I can in public, right? The idea that I'm going to give it to you in 3 minutes, almost impossible. That's their reality. Okay. Hope you enjoyed today's video. Thanks for watching.